My name is Taryn Villasenor, and I am currently enrolled in the nurse practitioner track of the master's program at Gonzaga University. I graduated with my BSN in 2012, and I've worked on the inpatient side of nursing for about 3 years now. I've worked on several different units, including med-surg oncology, and telemetry. My time at the bedside has taught me just how important the role of the nurse is in providing patients with support and information during very difficult times in their lives. I feel that this course is very important to review the ethical principles that should guide nurses at this time in our career before we consider moving into a more advanced practice role. I know many of us may have had an ethics course in our undergraduate or in our nursing prerequisite courses, but it is much different to be a nurse at the bedside and witness these situations in real life where there could be plans of care or patient decisions that we are unsure of from our own perspectives, but that we must support on a professional level. From a personal standpoint, I always try to remember the idea of patient-centered care that I learned back in nursing school and try to practice on a daily basis. It is so important to be a therapeutic listener and really hear what our patients' goals are and where they are coming from. It's our job to not be judgmental or not show any of our own personal bias and just try to be there to help them make the best possible decision. When reviewing these ethical principles, we do not want any harm to come to our patients and must always do what's best in their best interest. However, even with that guideline in mind, sometimes there are gray areas and we ourselves are not sure what is the best course of action. This is when we have to defer to the medical professionals and our patients and just try to support the plan of care with competency and respect. Within my scope of practice, I always try to come into my 12-hour shift with compassion and caring and really listen to what my patients' goals are for the day. On my unit that I work on, we have whiteboards on our units where we can go over with our patients in the morning and make individualized goals for them and try to reach them during our 12-hour shift. For example, if a patient is post-operative and they would like to walk 3 times that day to reach their baseline again, that will be one of our goals for the day. Another example is if a patient has a new diagnosis that they do not know that much about, I do my best to get them as much background information, whether it be a pamphlet or a video, and give them the opportunity to learn so that they feel more empowered to control their new health condition. Patient teaching is really important as a nurse, and I think that's one of the most important things we can do at the bedside to constantly keep patients aware of their plan of care and what and why we are doing the things that we do to help them. Then when they go home, they might have a better understanding of what is going on and be more compliant with whatever medication regimens or diet regimens that they may be supposed to be following. Furthermore, healthcare is in a big transitional stage right now, and there are a lot of stressors being placed on healthcare professionals, whether it be staffing ratios, new requirements for funding, and other things that management and other people might be concerned with. It is hard not to get distracted by some of these extra stressors, but at the end of the day, we are still nurses and must put our patients first. I feel another big part of my personal philosophy in nursing is, even though I've been a nurse for 3 years now, I still find that there are definitely things I don't know or situations or patient cases that I'm not familiar with. This is when we use each other as a resource and we ask our fellow coworkers and charge nurses for help. Nurses are constantly learning and teaching each other and educating ourselves through continuing education, and we need to use each other as resources. We also need to work as a team with our ancillary services such as respiratory therapy, nutrition, to really get the best possible well-rounded care for our patients. The hospital can be a very scary place for a lot of people. It is unfamiliar. Sometimes their privacy is not what they're used to having at home, and it's very difficult for people to adjust. So overall, at the end of the day, as nurses, we just need to be positive and compassionate and remind our patients that we're here for them and to take care of them, and that we will try to advocate for them as much as possible to get them competent, safe, and compassionate care. I look forward to working with everyone and learning from everyone in this course. Thank you.